New York City, the epicenter of the pandemic, this is Democracy Now!
We're fighting just to get this place closed down and sanitized. You know, they got 27 confirmed with the virus in there. They're sending them home. They're telling them that they're going to quarantine them for 14 days at home. They can stay home. They'll get paid. Nobody's getting paid. Nothing.
Just 1 week after Amazon fired a worker who led a walkout, workers at the same Staten Island warehouse walk off the job again to protest unsafe working conditions as online orders soar during the pandemic. We'll get an update. Then COVID deaths are spiking in Black and brown communities. Almost a third of New York City's infections are in Queens, one of the most diverse places in the world. Many in the hardest-hit neighborhoods are undocumented and working class. We'll speak with Congressmember Alexandria Ocasio-Cortez, who represents the neighborhoods at the epicenter of the coronavirus pandemic.
I just want to reassure our community that we are fighting for protections and that we're fighting to make sure that every single person gets the dignity and the safety that they deserve in this moment.
AOC's district also includes Rikers Island Jail, where at least one prisoner has died of the coronavirus and hundreds have tested positive. All that and more coming up. Welcome to Democracy Now!, democracynow.org, The War and Peace Report. I'm Amy Goodman. We're broadcasting from the epicenter of the pandemic, New York City. The global death toll from coronavirus pandemic is close to 76,000, including nearly 11,000 in the United States. In Britain, Prime Minister Boris Johnson spent the night in intensive care after his COVID-19 symptoms worsened Monday. A cabinet member has said Johnson received oxygen but has not yet been put on a ventilator. Britain's Foreign Secretary Dominic Raab is running Britain while Johnson is in the ICU. Johnson has been widely criticized for his government's initial approach to handling the coronavirus outbreak, which has killed more than 5,000 in Britain. Johnson initially discouraged social distancing and advocated for letting the virus burn rapidly through the population in order to build herd immunity. In early March, Johnson even boasted about shaking hands at a hospital treating COVID-19 patients.
I'm shaking hands continuously. I was at a hospital the other night where I think there were actually a few coronavirus patients, and I shook hands with everybody. You'll be pleased to know, and I continue to shake hands.
Here in the United States, up to 97% of U.S. residents are now under some sort of stay-at-home order, though the Trump administration has resisted imposing a national lockdown, despite the urging of Dr. Anthony Fauci, the top member of his coronavirus task force. There are now over 367,000 confirmed COVID-19 cases in the U.S., more than a quarter of the reported total cases worldwide, though the actual numbers, both in the U.S. and around the world, are likely far, far higher due to limited testing. A bipartisan group of 11 senators, including 4 Republicans, have called on Trump to invoke the Defense Production Act to address the nationwide shortage of protective equipment for first responders. A new report by the Health and Human Services watchdog confirms severe and widespread shortages of critical medical gear at hospitals across the country, putting medical staff at high risk. When questioned about the report Monday, Trump sought to discredit the findings, suggesting the HHS Inspector General was politically motivated. Trump also lashed out at a reporter after a question about failures to test people for the coronavirus.
We're the federal government. We're not supposed to stand on street corners doing testing. They go to doctors. They go to hospitals. They go to the state. The state is a more localized government.
This comes as the New York Times has revealed that White House trade advisor Peter Navarro starkly warned the Trump administration in late January that a coronavirus outbreak could lead to hundreds of thousands of deaths and tank the economy. Navarro cautioned in a memo that the, quote, risk of a worst-case pandemic scenario should not be overlooked, unquote, based on the situation in China at that time. The Washington Post reported over the weekend Trump also dismissed warnings about the coronavirus from U.S. intelligence and his Health and Human Services Secretary Alex Azar in January as alarmist. As infections mount across the United States, deaths among grocery store workers who are exempted from stay-at-home measures are being reported. At least 4 people, employees of Walmart, Trader Joe's, and Giant, have died from the coronavirus in recent days. Workers have reported dangerous and stressful working conditions, in some cases being forced to work without gloves or face masks or unable to take paid sick leave. Colorado, Minnesota, and Vermont have declared grocery store workers to be essential workers, extending free childcare and expanded paid sick leave. In election news, voters in Wisconsin face a choice today between exercising their right to vote and protecting their health after an 11th-hour attempt by Governor Tony Evers to delay the state's primary today through an executive order was quashed by Wisconsin's right-leaning Supreme Court. Wisconsin's Democratic governor and the Republican-led legislature have been battling over the fate of the election for weeks as Governor Evers has faced stiff opposition in his efforts to delay the vote over concerns about the coronavirus. Wisconsin's poll workers are overwhelmingly elderly. Many pulled out due to the dangers posed by the coronavirus. Milwaukee went from 180 to just 5 polling locations. Meanwhile, the U.S. Supreme Court sided with Wisconsin Republicans Monday in a 5-4 vote against extending the absentee ballot deadline to next week. Tens of thousands of Wisconsinites will have their votes thrown out, even though they will not even receive ballots until after Election Day due to a surge in demand because of the pandemic. Justice Ruth Bader Ginsburg warned in her dissent that the court's decision, quote, will result in massive disenfranchisement. In New York, Governor Andrew Cuomo said Monday the curve of coronavirus deaths appears to be somewhat flattening after the death toll stabilized at around 600 deaths on both Sunday and Monday. But he warned the situation is still dire and New Yorkers would need to maintain strict measures to continue the trend.
If we are plateauing at a very high level, and there's tremendous stress on the healthcare system. And to say to this healthcare system, which is at maximum capacity today, right? This is a hospital system where we have our foot to the floor and the engine is at red line, and you can't go any faster. And by the way, you can't stay at red line for any period of time because the system will blow.
Cuomo said schools and non-essential businesses will now remain closed until April 29th at least, and announced fines for violating social distancing rules would increase from a maximum of $500 to $1,000. As of today, New York State has nearly 5,000 recorded deaths from COVID-19, with over 131,000 confirmed cases and over 16,000 hospitalizations. The Trump administration and local governments are facing calls to release more detailed information on the racial makeup of who's dying from the pandemic. Initial evidence shows African Americans have been particularly hard hit. In Louisiana, where the death toll has topped 500, Governor John Bel Edwards says 70% of the victims have been African American, even though Louisiana is less than a third black.
Disturbingly, this information is going to show you that slightly more than 70% of all the deaths in Louisiana are of African Americans. Slightly more than 70%. And so that deserves more attention, and we're going to have to dig into that and see what we can do.
In Chicago, African Americans have made up over 70% of the COVID-19 deaths in the city, despite comprising just 30% of the city's population. On Monday, the Lawyers Committee for Civil Rights Under Law joined with hundreds of doctors urging the Department of Health and Human Services to release race and ethnicity breakdowns of COVID fatalities. The American Civil Liberties Union has sued a federal prison in Oakdale, Louisiana, after 5 prisoners died from COVID-19. The ACLU is attempting to force the Federal Bureau of Prisons to release prisoners who are at high risk for serious illness or death due to the outbreak. This comes as authorities in Ohio report 3 prisoners have died from suspected cases of the coronavirus at a federal prison in Elkton. The Ohio National Guard has been deployed to work inside the prison. As countries impose lengthy lockdowns to combat the spread of the coronavirus, reported cases of domestic abuse have spiked around the world. UN Secretary General Antonio Guterres called for governments to prioritize women's safety as many face mounting risks in and outside of their homes.
For many women and girls, the threat looms largest where they should be safest, in their own homes. And so I make a new appeal today for peace at home and in homes around the world. We know lockdowns and quarantines are essential to suppressing COVID-19, but they can trap women with abusive partners. Over the past weeks, as economic and social pressures and fear have grown, we have seen a horrifying global surge in domestic violence.
To see our discussion on domestic violence in the pandemic, go to DemocracyNow.org. On Monday, France reported its highest daily death toll after numbers from this weekend appeared to indicate the daily fatality count was slowing down. France's overall death toll is approaching 9,000, the 3rd highest in Europe after Italy and Spain, with confirmed cases approaching 100,000. Spain, which has the 2nd highest death toll on the continent with over 13,000 deaths, announced over 40,000 people had recovered and been discharged from hospitals. In more news from Spain, the Minister for Economic Affairs has said the government plans to implement a universal basic income as soon as possible to help workers and families recover from the devastation of the coronavirus pandemic. The Guatemalan government has asked the U.S. to limit deportations to 25 people per airplane to control the spread of the coronavirus. In recent weeks, 2 immigrants deported from the United States to Guatemala tested positive for COVID-19 and were later hospitalized. Meanwhile, as part of their social distancing measures, Peru and Panama are limiting the movement of residents by alternating days on which men can leave their homes with days when women can go outside. Transgender activists in Panama have spoken out against the system.
Women were filming some of my trans friends that were at the supermarket, and they said, "This isn't their day. Why are they coming out if they are men? They were dressed as women because this is how we dress. This is our gender expression. There's been a mistake." The president came out saying that they study things before making an announcement. I don't think they study their situation. Panama doesn't have a gender identity policy right now.
In Pakistan, dozens of doctors and nurses were arrested in the city of Quetta Monday as hundreds protested the government's failure to provide them with personal protective gear. Riot police also reportedly beat them with batons. Pakistan has reported nearly 4,000 COVID-19 cases and over 50 deaths. India's stepped back plans to halt exports of the anti-malarial drug hydroxychloroquine after the Trump administration threatened to retaliate against the planned move. India is the world's largest producer of hydroxychloroquine, which President Trump has repeatedly encouraged Americans to try and touted as a game changer in treating COVID-19 symptoms, despite medical experts warning more tests are needed. The 2 French doctors have provoked outrage after suggesting last week that a vaccine for the coronavirus could be tested in Africa. The World Health Organization's Director General, Tedros Adhanom Ghebreyesus, who is from Ethiopia, called the comments racist and said, quote, "Africa can't and won't be a testing ground for any vaccine." The United States is facing new accusations of blocking the shipment of U.S.-made medical equipment to overseas buyers. Ontario Premier Doug Ford said Monday the U.S. blocked delivery of 3 million face masks to Canada. as Ontario's stock of personal protective equipment is set to run out in just 1 week. Over the weekend, Germany accused the U.S. of modern piracy after a shipment of 200,000 German-bound protective face masks were diverted. Meanwhile, Barbados said Sunday the U.S. had seized a shipment of 20 ventilators headed to the island. In related news, the Associated Press is reporting federal purchasing contracts showed the Trump administration waited until mid-March before bulk ordering N95 masks, ventilators, and other essential medical equipment, even though hospitals and several states were already overwhelmed with an onslaught of coronavirus patients and were pleading for reinforcement from the Strategic National Stockpile. Cardinal George Pell, who's been accused of sexually assaulting boys, walked free from prison Tuesday after Australia's highest court overturned his conviction. Pell was sentenced to 6 years in jail last year for sexually abusing underage boys and is the highest-ranking member of the Catholic Church to have been convicted of a sex crime. He had been found guilty of multiple criminal acts and the abuse of 2 choir boys in 1996. Pell served as the Vatican's chief financial officer. The United Nations says a deadly shelling of a women's prison in Yemen's Taiz province Sunday could amount to a war crime. At least 5 prisoners were killed and 24 injured, including 4 children, according to Yemeni officials. The attack has been blamed on Houthi rebels. And for the first time ever, the U.S. has labeled a white supremacist group a terrorist organization. Secretary of State Mike Pompeo announced Monday the Russian imperial movement would be designated a foreign terrorist organization and impose sanctions on its members. The group is said to support neo-Nazi groups in Russia and in parts of Europe and provide paramilitary training to white supremacists. And those are some of the headlines. This is Democracy Now!, DemocracyNow.org, The War and Peace Report. I'm Amy Goodman in New York City, the epicenter of the coronavirus pandemic. My co-host Juan Gonzalez is joining us from his home in New Jersey, in New Brunswick, New Jersey, the state with the second highest number of reported deaths. 1,003 people in New Jersey have died. More than 41,000 have tested positive. It's good to have you with us, Juan, if not at my side, at least safe at home.
Hi, Amy, and greetings to all of our listeners and viewers across the country and around the world.
Well, Amazon warehouse workers in Staten Island walked off the job and stayed home from work Monday to protest unsafe working conditions as online orders soar amidst the coronavirus pandemic. The action came just a week after Chris Smalls, a worker at Amazon, was fired by Amazon after leading a walkout at the same warehouse known as JFK 8. More than 50 Amazon warehouses across the U.S. have confirmed COVID-19 cases, including the Staten Island warehouse, where at least a dozen workers have reportedly tested positive for the virus. This is Staten Island warehouse worker Rena Cummings.
I've recently been made aware that there are more positive coronavirus cases at the warehouse. I'm not going to work today because Amazon is putting my life at risk. They're putting my fellow workers' life at risk, as well as the community at risk. We need Jeff Bezos to close the warehouses with positive cases.
We turn right now to Angelis Solis, lead organizer at Make the Road New York. She helps lead the group's Beyond Amazon coalition in New York City and helped organize Monday's strike. In a minute, we'll talk about mutual aid organizing among immigrant and low-income communities and Make the Road's COVID-19 Emergency Response Fund. And we'll be speaking with Congressmember Alexandria Ocasio-Cortez for the rest of the hour. But right now, we turn to Angelis Solis. Describe the worker strikes at Amazon. Were you there? How are they organizing? What are people calling for? Angelis.
Good morning. To give some perspective on the scale of one of the largest warehouses on the East Coast, the JFK 8 facility in Staten Island employs thousands who come to work from Manhattan, Brooklyn, Queens, and Jersey. Now, our members walked out last Monday because of the report of 10 positive cases in the facility. This Monday, yesterday, over 60 workers walked out again because they are nearing 30 positive cases, and Amazon has not done enough to institute safety protections, health protections, ensure sick leave for individuals who are not just showing symptoms, but also have not tested positive. So members of Make the Road New York, workers organizing with New York Communities for Change, and the Athena Coalition took action to call on Governor Cuomo to intervene and to stop the spread of the transmission. Now, we have Amazon workers who are members who say that they feel proud when they go into work and are packing essential items like diapers and food and medicine, but so many don't feel the same way when they are walking into a facility risking their lives just to ship glitter tattoos and board games. Now, if we don't call on Amazon to put their billions towards protecting their workers and limiting the spread of COVID-19 in the supply chain, they are not only profiting from this pandemic, but they're helping to perpetuate it. The virus has been shown to survive on cardboard, so we are talking about protections for the workers from the warehouse through the delivery chain.
Well, Angeles, I wanted to ask you, Amazon is one of the companies that's actually enjoying windfall profits as a result of the current crisis because the number of online orders has so sharply increased, 50% increase in the orders of food orders to Amazon. Could you talk about how has the company dealt with since the crisis inside of its plans for what you're hearing from the workers in terms of protection for them?
Absolutely. Far too many workers do not have enough masks, gloves, or proper protective equipment. There have not been strict enough social distancing measures inside of crowded break rooms. Picture thousands of workers using the same turnstiles, the same microwaves, the same bathrooms. There has been cleaning around them, but there has not been sanitation closures or commitment to 100% pay for workers who go home. Now, this is an opportunity to make very bold demands of the richest corporation in the world. For far too long, corporations like Amazon have paid nothing in taxes, and that has starved our safety net hospitals, our public hospitals like Elmhurst that require resources to deliver the care we need in this moment.
Vice News recently reported, they obtained leaked notes from an internal meeting of Amazon company executives discussing a plan to malign Chris Smalls, calling him not smart or articulate. This was apparently part of Amazon's PR strategy to smear Smalls and make him, quote, the face of the entire union organizing movement. Angeles, can you respond to this?
Absolutely. I would say that Amazon's actions towards Chris indicate a pattern of disrespect for all of the employees in the workforce who speak out against dangerous working conditions. There is a reason that Amazon has been named one of the most dangerous workplaces in America by the National Occupational Health and Safety Administration. And it is because when workers speak up about dangerous conditions on their job, Amazon swiftly suppresses worker organizing, cuts corners, and ensures that workers do not have the ability to speak up on the job safely without feeling intimidated. And their actions toward Chris are not only quite frankly racist, especially towards a Black man in America, but indicate how they treat whistleblowers across their supply chain.
Angeles, I wanted to ask you on related to what's going on in Queens. Make the Road has been very active among the immigrant communities in Brooklyn and Queens for years. What do you attribute this enormous spike in illnesses, especially and deaths in Queens and the Elmhurst Hospital area?
The areas in where our members are most concentrated, the neighborhoods of Jackson Heights, Elmhurst, and Corona, have become the epicenter of the coronavirus with 20,000 cases and counting. This is the heart of immigrant New York, one of the most diverse zip codes in the country. It is an area with a high density of low-income families who are forced to share in overcrowded housing, which increases the viral transmission inside of a household. It is an area where far too many people live paycheck to paycheck, and for a long time, denial to health care coverage has contributed to chronic health conditions. Now, we have lost members of our community, members of our organization to this virus, and in our grief, we organize. We organize because 40% of adult Latinos in New York City have lost their job and the ability to bring food home to their families. We organize because on April 1st, 40% of New York City renters came up short on rent, and because our state has yet to enact a rent suspension, far too many have to choose between paying for food or paying for rent.
Angeles, just this week, I've heard of one horror story after another. 2 Mexican immigrants who've lived here for decades, brothers, died in their home, didn't even make it to the hospital. Another immigrant, again undocumented, died. What efforts are you involved with Make the Road to reach out to people? How afraid are people to go to the hospital? Like perhaps they're turning themselves into a police station or something.
Absolutely. The Trump administration has for far too long demonized immigrants, despite the fact that 27,000 Dreamers are at the front lines of the medical fight in the United States. Now, here in New York City, almost 90% of the delivery workforce are immigrants. 2/3 of those are undocumented. That means that those delivering food to those who most need it, they themselves cannot access life-critical benefits. The federal and state stimulus packages fall far too short of what undocumented workers need. This moment calls for a hard look at every single decision maker who willfully neglects the hardworking undocumented immigrants who pay millions in taxes but do not have the ability to access social benefits. And as such, we have several different initiatives and organizing efforts. One, our members are despite being at home, it does not mean that they're not in the fight. We are still calling for a just stimulus of what we need. We need federal and state packages that provide income streams directly to undocumented immigrants because currently this population cannot access unemployment benefits. This virus does not discriminate based on immigration status. So it does not make sense that our administrations are not preparing and providing cash assistance so that all people, regardless of immigration status, can participate in social distancing. We are organizing delivery workers to advocate for hazard pay, increased access to testing and treatment, and increased proper protective equipment as well. We have organized mutual aid efforts and a number of funds, including a whistleblower fund for Amazon workers across the country. Since the strike at JFK 8, we have seen strikes in Detroit and Chicago, and the same pattern of silencing whistleblowers from the richest corporation in the world. We have organized an emergency response fund where listeners and viewers can donate to directly support over 3,000 members and more with assistance for buying food. We also have started a mutual aid bike brigade program, which delivers pantry essential items from Make the Road pantries in Brooklyn and Queens straight to our most at-risk members' homes.
And Angeles, I wanted to ask you about the Governor Cuomo. He's received a lot of attention from the commercial media in recent weeks, many praising his decisive and clear-headed leadership for New York State. I'm wondering your assessment of how Governor Cuomo has functioned up to this point.
While New York Governor Cuomo enjoys his moment of fame on a national scale, his actions behind the scenes have harmed thousands of New Yorkers. He passed an austerity budget that fails the working poor and favors the rich. Now, just on the topic of Amazon, while the governor of Kentucky immediately intervened when positive cases of COVID popped up in Amazon warehouses, our governor has yet to respond to the strikers calling on him to ensure their safety and the safety of the public. And in fact, this was the man who wanted to rename himself Amazon Cuomo. And we need the governor of New York to enact real protections for all undocumented immigrants, for all workers in our state. Leadership in front of a camera is one thing, but behind the scenes, the budget has hurt our communities. It has taken resources from our schools. It has made cuts to Medicaid, and it has failed to tax the rich and billionaires in our state that have the ability to provide the resources and do their part to slowing the spread of this crisis.
We want to thank you, Angeles Solis, lead organizer on the workplace justice team at Make the Road New York. When we come back, we'll be joined by Congressmember Alexandria Ocasio-Cortez for the rest of the hour. Her district includes the areas hit hardest by the coronavirus: Queens, the Bronx, and Rikers Island. Stay with us. The New York Philharmonic Orchestra performing Ravel's Bolero from their homes, sending their gratitude to frontline healthcare workers. Every night, the Empire State Building pulses red in honor of all of those essential workers who are protecting everyone. This is Democracy Now! I'm Amy Goodman with Juan Gonzalez. I'm broadcasting from New York. He's in New Jersey. Here in New York, the coronavirus death toll has nearly reached 5,000. We're spending the rest of the hour with U.S. Congressmember Alexandria Ocasio-Cortez, who represents the neighborhoods that have been called the epicenter of the coronavirus pandemic here in New York City, Queens, and the Bronx. Almost a third of the city's COVID-19 cases are in Queens, which has been called the most diverse place in the world. Many of the hardest hit neighborhoods in those neighborhoods are undocumented, working class, working poor. In Elmhurst, Queens, more than 2/3 of residents were born outside of the United States. The majority are Black and Latinx. Queens has more COVID-19 cases than any other borough, yet it has fewer hospitals than its neighbors, with only 3 major medical centers. The New York Times reports Queens has 1.5 hospital beds per 1,000 people, compared to 5.3 in Manhattan. Congressmember Alexandria Ocasio-Cortez's district also includes Rikers Island Jail, where at least one prisoner has died of complications of COVID-19. Hundreds have tested positive. Rikers currently holds just over 5,000 people, many there for parole violations or serving less than a year for a low-level offense. Many are there in pre-trial detention. They simply don't have money for bail. On Friday, Congressmember Ocasio-Cortez tweeted, quote, "COVID deaths are disproportionately spiking in Black and brown communities. Why? Because the chronic toll of redlining, environmental racism, wealth gap, etc. are underlying health conditions. Inequality is a comorbidity. COVID relief should be drafted with a lens of reparations," she wrote. Alexandria Ocasio-Cortez joins us now. Thank you so much for being with us, Congressmember Ocasio-Cortez. Can you start out by talking about your district? We have heard a lot about Elmhurst Hospital, as we should. The doctors and the nurses, like so many around the country, and the sanitation workers in these hospitals are not properly protected. We have not heard as much, and there may be a deep connection here, about the community that it's serves. In just the last week, I've heard about 3 men, 2 Mexican brothers who died in their home, not even in the hospital. Their bodies just recently taken out. A third died in the hospital, but fears of even going to hospitals, knowing what could happen to them, who've been hard-working members of our communities for so many years. Talk about your community.
Yes, no, thank you. And thank you for the opportunity to discuss the actual community surrounding Elmhurst Hospital and Elmhurst, Queens. This is one of the most working class and, as you mentioned, blackest and brownest communities in New York City. It is extraordinarily dense. Even for New York City, it is a very dense and densely populated community. It's no surprise that, you know, in the wake of this pandemic, right after the Trump administration announced its public charge rule, which basically said if you are undocumented and seek public services, public health care, SNAP, WIC, et cetera, then you will be essentially put on a fast track to either denial of citizenship or outright deportation. And so now that we have this pandemic, and it is hardest hitting in communities that are heavily immigrant and also with strong historically Black communities as well, that people are either afraid to go to Elmhurst Hospital out of the cost or out of sheer fear that they will be put in the public charge list. Now, after we pushed the Trump administration, we were able to secure confirmation from the administration that they would not refer COVID-related cases and treat them under the public charge rule. But there's so much confusion already that many members are scared to go.
These are the same people who are preparing our food. They're the same people who stock our grocery shelves. They're the same people who deliver our goods. And the idea that we can deny them care as though the pandemic will not affect us in greater ways because of that is naive and it's unscientific.
And Congresswoman, I wanted to ask you about this enormous racial and ethnic disparity in the cases and especially in the deaths that are occurring. As you mentioned, and as Amy mentioned earlier, the areas of Elmhurst, Jackson Heights, and Corona are the epicenter of the epicenter. But the Bronx, a portion of which you also represent, your congressional district stretches out there, has also been hard hit. According to as of 10:59 last night, according to the tracker that the city website produces for New York City every day, there were 679 people, Bronx residents, who had died of coronavirus. That's more than twice as many as have died in Manhattan, only 302 in Manhattan, even though the Bronx is significantly smaller in population than Manhattan. And you've got a situation where the Bronx is 16% of the population of the city, but it's represents 24% of all the deaths. So we have a situation here where even in Brooklyn, the areas of Brooklyn where most residents are dying are in the North Brooklyn and the Black and brown communities. How do you assess the city and the state's response to what is clearly a disparate impact of this epidemic?
Yes, well, as I had mentioned earlier, inequality, environmental racism, these are pre-existing conditions. And when you have a pandemic, similar to what we saw with Hurricane Maria, when you have a natural disaster or an event like a pandemic hit communities that have already been ravaged by weakened healthcare systems, weakened infrastructure. The South Bronx has one of the highest childhood asthma rates in the country. When we talk about environmental racism, we're talking about illegal dumping. We're talking about concentrating waste sites and concentrating highways and trucking zones through the poorest communities in the country and the blackest communities and the brownest communities. And so we already have an issue of extreme and acute concentration of respiratory illnesses in the Bronx. That is largely due to the trucking that comes through here, through the environmental inequalities that come through here. And so when you have the Cross Bronx Expressway, which was a notorious project of racism by Robert Moses, the way that he tried to concentrate and push these communities and design these communities through. When you have the toll of health inequities, and on top of that, these are our frontline workers. Where you see our frontline workers living are the same places where you are seeing COVID cases spiking. Black and brown workers are overwhelmingly part of this front line. They are the grocery store workers. They are the delivery workers. They are hospital workers, including janitorial staff. And so when you have this pandemic layer on top of it, when you pair that to the unequal access to care, when you pair that with ratios of hospital beds far lower than more affluent communities, this is what you get. And so when it comes to the city's response, I believe that the city is doing absolutely everything that it can, but we also have to acknowledge that there are two entirely different starting lines that these communities are starting with. And so we've been working very hard, but also, when we don't push for things like full rent and mortgage moratoriums, you push these workers to go outside because they feel a pressure to make their rent, and they may go out and take work. They may take work under the table in order to make ends meet. And so without this economic relief, it also adds to the public health issues that we currently face.
After break, we're going to talk with you about the stimulus package, about what you've called the corporate slush fund, that $500 billion, and how it will be monitored. But I want to ask you about another area of your district, which also goes to you as a Congress member dealing with prisons and jails all over the country, but Rikers Island, the whole jail system there in New York. What, Rikers Island, 4,600, 5,000 in the New York City jail system. Are people still being sent there for pretrial detention simply because they don't have enough money to post to stay out of jail? And what's happening? We see hundreds of both prisoners and staff have tested positive. There's already been a death. What about the calls for decarceration, for releasing prisoners, not only at Rikers, but then around the country now? Tell us where they stand.
We've been approaching it, and we've been calling very strongly on the governor and the mayor to take a strong decarceral approach to Rikers. That first death, not that any death on Rikers is merited, no matter what anyone has done, but that first death wasn't even for a criminal offense. It was for a simple parole violation that was non-criminal in nature. And so what we're seeing here is that the city is packing Rikers with individuals, and they know it's a tinderbox. It's a tinderbox for the workers. It's a tinderbox for incarcerated people. And we have to demand, not just in Rikers, but across the country, we need to increase our demands for elderly clemency, to end pretrial detention as much as possible, to make sure that we are not arresting people for low-level arrests. We've been placing inquiries to see if there are people being moved to Rikers. We believe that the mayor is trying to take off low-level arrests, but there are still so many individuals that do not belong there. And that also goes for our immigration detention facilities. ICE was knowing that this pandemic was coming, knowing everything that was happening. ICE was still conducting raids in sanctuary cities. And, this was part of a larger political project by the president to punish those cities that act as sanctuary cities for immigrants. And so ICE as well is knowingly packing these detention facilities with people who, again, have not committed crimes, but are merely there for civil proceeding reasons, and who are merely awaiting a court date. And so there's no reason that these jails should be filled. There's no reason that they should be packed. We must pursue a decarceral agenda in order to really fulfill our responsibility as public servants.
Can I ask you, just before we go to break, Congressmember, you confronted an ICE agent at LaGuardia Airport. If you could talk about this, what exactly was happening, who was transporting immigrant children? Can you explain what happened?
Yes, so this happened several weeks ago. I got a call in the evening from one of our local immigration community organizations, New Sanctuary Coalition, and they had gotten a tip from a worker that ICE was transporting six children into New York City from a different, from Texas. And we were extraordinarily concerned, and so we decided to hop into a car, drove straight to LaGuardia Airport, and I just waited at the gate. And after some time, an ICE agent came out with 6 young boys, and they were being transported into New York City. This was after the pandemic had erupted. This was after the Pentagon already started banning much domestic travel for members. And here we have ICE transporting children into a pandemic zone, into the most concentrated area of the most concentrated city. They were flying into LaGuardia. They weren't even flying into JFK or Newark. They were flying into the shadow of East Elmhurst Hospital. And so I confronted the agent. They were transporting these children into ORR facilities here in New York City, where staffers have been confirmed to have COVID-19 cases. And after inquiring, we started to make a lot of noise about this. ICE since then has started to place some restrictions, but not nearly enough to protect these children and to protect all immigrants in our system.
Last month, a reporter asked Trump if undocumented immigrants are welcome at testing sites, and can they be tested without fear of being reported to immigration authorities. This is what President Trump said.
The answer is yes, we will do those tests because I think in that case it's important. I think that if you could say illegal alien, you could say illegal immigrant, you could say whatever you want to use your definition of what you're talking about. We're all talking about the same thing. Yes, we will test that person because I think it's important that we test that person, and we don't want to send that person back into wherever we're going to be sending the person, whether it's another country or someplace else, because, you know, we're now bringing them right out of our country. But, yeah, we will test those people.
Wow. I mean, so there you have President Trump talking about, yeah, test them before you send them out. Overall, your response to President Trump, his antagonism against any kind of criticism, the well-known documented lack of tests, lack of PPE, protective gear for people who work in hospitals, and now this, saying, sure, test them before we deport them.
Well, overall, you know, not just President Trump, but this entire administration knew what was coming. Trump knew this pandemic was coming. The military knew this pandemic was coming. The CDC knew this pandemic was coming. HHS, Health and Human Services, knew this pandemic was coming. And there was a structural, but also universal refusal to acknowledge and, more importantly, to act. And this pandemic is, you know, and the casualties that we are seeing are, again, not just due to coronavirus. There are people dying unnecessarily. As you mentioned earlier, there are people not just dying in hospitals. In New York City alone, we are seeing 200 to 300 people dying in their homes a day. Per day in New York City, inside their homes. In addition to the hospitalizations, these numbers that you're seeing, all in all, many of them are confirmed coronavirus cases. As you mentioned, many people do not have access to tests. So a lot of these deaths that you are seeing, there are many more that are uncounted, that are being counted as pneumonia or being counted as other causes of death because those people were not able to get a COVID-19 test. And so these additional deaths, many of them are unnecessary. They are deaths of incompetence. They are deaths of science denial. They are deaths of inequality. And so it's important for us to acknowledge how unnecessary the level of crisis that we are at right now, that is due to the incompetence of this administration, that is due to the lack of responsiveness of this administration. And when it comes to the particular cruelty to undocumented immigrants, it is also a form of denial of the fact that many of these undocumented people pay taxes, they fund our public schools, and they fund the very public health system that they are being denied access to right now through the billions of dollars of taxes that they pay. Billions more, by the way, these undocumented workers pay billions more in taxes than Facebook does, than Amazon does, and than many other corporations do. And so when it comes to contributions to our public systems, they do far more than these corporations do. And it's extraordinarily important that they have safe access to our public health system. And by the way, it shouldn't just be for COVID-19 cases. Our public health system should be free at the point of service for every single person in this country. There are folks that are saying, oh, you'll get paid sick leave if it's COVID-19 related. As we're seeing with Amazon, they'll take your fever. If you don't have a test, then you will not be paid, you will not receive paid sick leave. We should have universal systems where every person can see the doctor free of charge when they need to see it so that they can get the care that they need. That is what it means to live in an advanced and modern and humane society. And so long as we don't do that, we have not earned the right to call ourselves one.
We are speaking to Congressmember Alexandria Ocasio-Cortez. We'll be back with her in 30 seconds.
Imagine there's no heaven. It's easy if you try. No hell below us. Above us only skies. Imagine
after Elvis Francois singing John Lennon's Imagine. He's from the Mayo Clinic. This is Democracy Now!, DemocracyNow.org, The War and Peace Report. I'm Amy Goodman with Juan Gonzalez. We're spending the rest of the hour with Congressmember Ocasio-Cortez. This is the Congresswoman speaking on the floor of the House about the $500 billion corporate bailout, part of the massive coronavirus stimulus package.
We have to go into this vote eyes wide open. What did the Senate majority fight for? One of the largest corporate bailouts with as few strings as possible in American history. Shameful. The greed of that fight is wrong for crumbs, for our families. And the option that we have is to either let them suffer with nothing or to allow this greed and billions of dollars, which will be leveraged into trillions of dollars, to contribute to the largest income inequality gap in our future.
That was Congresswoman Alexandria Ocasio-Cortez prior to the vote on the stimulus package. Congresswoman, could you talk about the debate that you had within yourself in terms of whether to support this package, given the enormous tax breaks and the direct grants and loans to corporate America?
Yeah, well, you know, I think ultimately this debate, it was up to each and every member. I don't slight any member for how they voted. I could not bring myself to ultimately support this bill because I believe that people will soon see the extraordinary asymmetrical assistance that went to corporations. We're not just talking about $500 billion that went to Wall Street, as I mentioned in my remarks. That is being leveraged to $4 trillion for Wall Street and corporations. And what we're seeing in payroll protection for small businesses is just a drop in the bucket compared to that. But ultimately, what this administration did was hold every hospital hostage, hold every frontline worker hostage, and it is not an easy decision whatsoever for any member. But ultimately, I think that people will soon see the betrayal that was in this bill that was pushed forward by the administration and by Mitch McConnell. It is completely unethical and inhumane what has been done. And when we talk about the oversight in this bill, it is far too little. It is far too flimsy. And what we have essentially done was give Steve Mnuchin a blank check to pick and choose who this administration will reward with $4 trillion.
And I wanted to ask you on the portion of the stimulus package that supposedly will go to the American people and the American workers, the particular issue of what happens to, first, there's a $1,200 per person outright grant that is given by the government, and then the added unemployment benefit of $600 a month for several months. The reality is, as you well know, that especially when it comes to the undocumented, they will not get any of that $1,200. And more importantly, even on unemployment, there are so many millions of people that work off the books in America, and obviously they cannot qualify for unemployment, so they will get no assistance whatsoever.
That's exactly right. And then on top of that, you also have a carve out of young people where if you are claimed as a dependent on someone else's taxes, but you are above the age of if you are 17 or older, you also receive no assistance and no cash assistance as well. So this is disproportionately hurting the young. It's hurting the undocumented. It's hurting people who work off the books. And which is to say that it hurts some of our most vulnerable populations. And the people who need that help the most right now, some of the people who need it the most are also not getting it, which again contributes to a public health crisis in addition to an economic one.
Congressmember Ocasio-Cortez, before we go, we wanted to ask you about the election. They're holding the Wisconsin primary today, despite the adamant opposition of the governor and so many in Wisconsin. I mean, I think in Milwaukee, they've closed over 100 polling places because they're often run by elderly poll workers and they're not coming in. But I want to ask you about the presidential election. You are the most high-profile surrogate of Bernie Sanders. You have been there with him in state after state. What is happening with his campaign right now? What are the plans?
Well, I do know that, like myself, the senator and I have both been focusing very heavily on COVID relief up into the CARES 2 package. I think right now one of the key things that we must push for, we must fight for, is the same thing that we have continued to fight for. We need to make sure that I believe that there are very strong concessions and accommodations made for a progressive future in our country. And I think when it comes to that, we need to see very serious movement towards a single-payer healthcare system, towards a living wage, towards justice for incarcerated people and justice for our immigrant populations. We need to have a strong agenda across the board. And without any sort of progressive conversation or progressive definition or concession to our party, we have to continue pushing forward. And so when it comes to the specific things, ultimately that is up to the senator. But I know, for one, that we must continue pushing to make sure, and particularly on climate change, what kind of agenda is being formed right now, and not only what that agenda is, but who is going to be making those decisions and really administering and executing on that agenda.
Do you know if he will go to the convention, if he will continue to be a presidential candidate through to the convention, if a convention is even held?
Yeah, whether the convention is held is an excellent question. I do not know. That is ultimately up to the senator. I think he makes these decisions one phase at a time, looking ahead to the next primary. I don't think that. I do not believe that he is set one way or another.
We're going to leave it. We're going to leave it there now. And I want to thank you so much for being with us, Congressmember Alexandria Ocasio-Cortez, U.S. Representative for New York's 14th Congressional District. That does it for our show. Democracy Now! Is brought to you by an amazing group of people committed to bringing you the most accurate information. I'm Amy Goodman with Juan Gonzalez.